let us now discuss the X-rays of paranasal sinuses. Now, before I start this topic, let me remind you one thing, that these X-rays are nowadays clinically obsolete. We don't use them in the clinical settings these days. Okay, but I'm teaching you this topic because it's a very, very important topic for you in the MCQ exams. It is being asked regularly in the different MCQ exams. We'll see a lot of questions have been asked in the last few years itself. Okay, and it will help you understand the anatomy and the further radiology, the CT scan of the paranasal sinuses. So let us start with the X-rays of the paranasal sinuses. Now the first question is most commonly done X-ray view. Okay, so when I say X-ray, that means the plain X-ray. So most commonly done X-ray view for the paranasal sinuses was the Waters view. Alright, so this was the most commonly done X-ray view. Now what we do in this Waters view? We make a patient stand facing the X-ray plate. So you can see the patient is standing facing the X-ray plate such that his nose and chin, they are touching the X-ray plate. So this is known as nose-chin position. So you can see the nose and the chin, they're touching the X-ray plate. Now you give a beam, an X-ray beam from behind, from the occiput. And this X-ray beam, it comes out from the mentum. So this view is also known as occipito-mental view. Okay, so we have the Waters view. This is known as nose-chin position, or also known as occipito-mental view. Right? So let's come to this X-ray, the Waters view X-ray. What can we see in this X-ray? You can see in this X-ray, number one, the maxillary sinus. Okay, so that sinus is clearly visible. We know that is the largest paranasal sinus. What else can we see? We can see the frontal sinus. Yes, that is also very clearly visible. What else can we see? We can see the orbits. On the two sides, you can see the eyeball, the orbit. Okay, what else can you see? You can see in the center, there is the nasal septum. So in the midline, we can see that there is a nasal septum. On the two sides of the nasal septum, you can also identify the nasal bones. Okay, so you can identify the nasal bones. Now see carefully. Between the nasal bone and the orbit, you can see over here that between the nasal bone and the orbit, there is air cell. On both the sides, you can see that there is an air cell. And these air cells, they belong to anterior ethmoid sinuses. Okay, so in Waters view, you can see the maxillary sinus, the frontal sinus, the anterior ethmoid sinus. Now notice one thing over here, in this X-ray, the patient jaw is closed. Okay, so this patient is doing the X-ray with mouth closed mouth. Suppose I repeat this X-ray with the open mouth. Okay, so you see we have done over here Waters view with a open mouth. Okay, now what can we see over here? Again, we can see the maxillary sinus, we can see the frontal sinus, we can see the anterior ethmoid cells. Okay, look over here on this side also, you can see this anterior ethmoid cell. But apart from that, very important, we can see the sphenoid sinus. Okay, so from this open mouth, you see, between the upper jaw and the lower jaw, if we do the Waters view with the open mouth, you can see the sphenoid sinus. Okay, so sphenoid sinus is visible in Waters view with open mouth. That's a modified Waters view. Now look over here in this. This patient is standing once again facing the X-ray plate. His nose and chin, they are touching the X-ray plate. Right? So we can see the nose and chin, they are touching the X-ray plate. But the patient mouth is open. So this is known as Waters view with open mouth, also known as Pierce view. Okay, remember this is again an occipito-mental view, but with a open mouth. Okay, so occipitomental view with open mouth or Waters view with open mouth, that is known as Pierce view, right? Okay, and therefore in this Pierce view, the important point for us is that we can also see the sphenoid sinus, right? Coming back to the Waters view, remember that we can see these sinuses in the Waters view, but question is which we cannot see. Sinus that you cannot see in Waters view, and that is the posterior ethmoids. Remember, this is the best answer. Why? Because posterior ethmoids you cannot see with closed mouth as well as with open mouth. Okay, so somebody asks you which sinus is not visible in Waters view, your answer should be posterior ethmoids. It is not visible in either of the two views, open mouth, closed mouth. If posterior ethmoids is not given in the choices, then your next best answer is sphenoid sinus, because sphenoid sinus is not visible in closed mouth, the classical Waters view. It is visible only when you do Waters view with the open mouth, which we also sometimes call as Pierce view, right? Okay, another question important is that this Waters view is mainly used for the diagnosis of disease of the maxillary sinus. Okay, so it was mainly used to diagnose disease of the maxillary sinus because this was the nicely visible sinus over here. Okay, so now another question comes that this Waters view, remember this Waters view is best for, it is best for maxillary sinus and anterior ethmoids. So this was the best X-ray view for maxillary sinus and anterior ethmoids. Anterior ethmoids, yes, the best we can see in the Waters view, but then this Waters view was used mainly for maxillary sinus diseases, right? Okay, now that's a question which was used, which was asked in the exam NEET January 2018. So as I told you that these questions are being repeatedly asked in the exams. Waters view is used to obtain diagnostic information of, and we know that the best answer for us is maxillary sinus. Okay, so mainly it is for maxillary sinus. Okay, let's look at another question. Occipitomental view with open mouth seen as shown in the given figure is also known as. So this is again a recent question. It was asked in the NEET PG January 2020 exam. So pretty recent question. As I was telling you, this topic may be redundant, it may be obsolete, but these questions are still be asked in the MCQ exams on a regular basis. So they're very important, right? So occipitomental view. Now we know occipitomental view is the Waters view, but the catch over here was with open mouth. Okay, so when it is open mouth, we call it as Pierce view. As you can see over here, the jaw is open. You can see the sphenoid sinus from here. So this question, the answer was Pierce view. Okay, so we have discussed the Waters view. We have discussed the Pierce view. Cardwell's view, I'll just teach you in a minute. Let's see what is the Townes view. Townes view we have discussed in the ear, in the radiology of the ear. Now this Townes view, the patient stands against the X-ray plate like this. The X-ray plate is behind the patient and you give an X-ray beam at 30 degree to the horizontal, and this is known as Townes view. It's a skull apiaxial view at an angle of 30 degree. Okay, so it's a skull apiaxial view, and this view is used mainly in the ear radiology to see the internal auditory canal. So as you can see over here, this is the X-ray of the Townes view, and you can see the internal auditory canal, the IAC, right? So that is the Townes view. You can also compare the mystoids, pneumatization of the two sides, the right and the left. So it is mainly used for the ear radiology and not to do with the paranasal sinuses radiology. Okay, let's come to the Cardwell's view. So as we were discussing that the best view for the maxillary sinus and the anterior ethmoids is Waters view. Now the Cardwell's view is the best view for frontal sinus. Okay, so this is the best X-ray view for frontal sinus. Right? Now, what do we do in the Cardwell's view? You see, in the Cardwell's view, you make the patient once again stand facing the X-ray plate. So as you can see over here, patient is standing facing the X-ray plate. Now, if you notice, his nose and forehead are touching the X-ray plate. So what do we do in Cardwell's view? In Cardwell's view, as you can see over here, once again, we make the patient stand facing the X-ray plate. So as you can see over here, now the patient nose and forehead, they are touching the X-ray plate. So this is known as nose forehead position. Right? Okay. And what we do now, we give an X-ray beam from the occiput. Okay. And these X-ray beams, they come out from the frontal region. So this is therefore also known as occipitofrontal view. So Cardwell's view, we have the nose forehead position or the occipitofrontal view. Right? And this is the best X-ray view for frontal sinus. Okay, so this question was asked in the NEET January 2018. Cardwell's view is used for. So now we know the answer is frontal sinus. Right? Clear? Okay, now remember, before I go ahead and you see over here, just remember that the Cardwell's view is the best view for frontal sinus, yes, of course, as well as ethmoid sinus. Now, remember over here, this is very important. You see, when I say best view for ethmoid sinus, my answer is Cardwell's view. Okay, it is not Waters' view. Why? Because in Waters' view, you are able to see only the anterior ethmoids. You cannot see the posterior ethmoids at all. So best view for ethmoid sinus, the answer will be Cardwell's view, because in Cardwell's view, as you can see over here, you can see both anterior and posterior ethmoids. Okay, so best view for ethmoids, right? Answer will be Cardwell's view. If somebody says best view for anterior ethmoids, then the answer is Waters' view. So don't get confused. I'm clarifying, only ethmoid word is written, answer is Cardwell's view. Anterior ethmoid specified, then we have the Waters' view. Okay, but again, this view is mainly used for the frontal sinus diseases. Okay, so as we saw, this is mainly used for frontal sinus. So that was the answer to this question. Okay, other question, which of the following views is best for frontal sinus? So answer is once again Cardwell-Lux view. Right? Okay, so this also we have just studied. Now another question which have been asked in the exam, in which view can we see all the sinuses? So the answer is lateral view. Look at this lateral view. We can see the frontal sinus, we can see the ethmoids, both anterior and posterior, we can see the sphenoid sinus, and we can see the maxillary sinus. So all sinuses, so this is another MCQ question, all sinuses, they are visible in lateral view. Right? Okay.